Alright, so I've chosen to do my video on CAR T-cell therapy and elaborate more on what that is and how it's done and what the future for it looks like. So we'll start with looking at what a T-cell is just in general. And basically it's just a white blood cell, and it goes around the body looking for infections and things that are foreign to the body that could harm the body. It's key, very essential to the immune system in the body. And there are two types of T cells. You have your first type, which is a killer T cell, and they can go throughout the body and scan the surfaces of cells in the body, and if they see one is foreign and harmful, they can hunt this cell down and destroy it and get rid of the foreign cell, the bad cell. And then you also have helper T cells. These cells don't, it's basically the name helper, they don't attack. They basically sit back, recognize something as being foreign or harmful to the body, and they orchestrate a response to it. So they get basically something that will work better to destroy this cell that it doesn't recognize. They have, they have many different functions when it comes to the body. Like I said earlier, they scan the environment for anything that they see as foreign. So if they see something foreign, they go after it. They either kill it or they send a signal that says, "Hey, we need to get rid of this." They directly kill any of these bad cells, and they also can remember cells that they have encountered long ago. So any bacteria or anything that they've encountered long ago that they've fought off, if it makes a recurrence, they remember it, they know it, and they can go right after it and attack it. So from here, we need to look at the cancerous cell and why these T cells, normal T cells, don't really kill these cells. So basically, T cells have protein receptors on their surface, and when it goes to attach to something to kill it, these protein receptors attach to antigens that are on the outside of these cells. And more times than not, it attaches to these antigens, it releases its toxins into the cell, and it kills it and wipes it out. However, cancerous cells aren't normal cells. They're not normal viruses. They're not normal infections. They have responses to not allow T cells to eradicate them and get rid of them. First thing they can do, they can disguise themselves. So they can make themselves look completely normal, like a normal healthy cell, and the T cells will bypass it, go on about its day, and look for other cells that need to be taken care of. They can grow or sprout many antigens on their surface. So basically, the more antigens on the surface, the harder it is for the T cells to combat this cell. Then lastly, they can turn off the immune response that doesn't allow these T cells to have any kind of effect on the cell. And this is why the body can't just naturally get rid of most cancer cells. So scientists have been looking and studying, and this is where the CAR T cell really comes into play. The CAR T cell has the chimeric antigen receptors that are attached to the outside, and this allows for attachment to these antigens. But how do we get the CAR onto the T cell and back into a patient? Well, it starts with blood being drawn from the patient that the therapy is going to be performed on. And then once the blood is received, it's separated into, so you have your red blood cells, your white blood cells, and then your platelets. And then the white blood cells or T cells are extracted from this, and then they are transported to the lab. In the lab, they combine the T cells with the genes for the CAR cells, and the CARs are attached to, or they're mixed in with the T cells. So once this has happened, then you get the CARs that show up on the outside of the T cell. So now once that they have successfully created the CAR T cell, this T cell now is able to recognize antigens on tumors, and they can go after them, target them, and kill them. So from here, the cells need to be multiplied, and they're grown in the laboratory, and until they get enough where they feel confident enough to send them back to wherever the patient's at, whether it's a hospital or a cancer center or somewhere like that. Once the hospital or center receives the CAR T cells, they will be infused into the patient. Usually before they're infused into the patient, lymphodepletion, which is a chemotherapy, happens. And what this does is basically it just creates room for these CAR T cells to be inserted into the body and eliminate some of the T cells that are already in the body, and just allows more room for these cells to grow and reproduce. And then once they're in the body, they can attack the cancer cells that are wherever the cancer is located. One good thing about this type of therapy is that it can help against a relapse in patients, because once the cells are reinserted into the patient, then they can grow and develop as these CAR T cells inside the person, and so they can develop more and more of these cells to combat these different cancers. However, there are some side effects that come with this type of therapy. One, and it's the most common, and you see it in most of your CAR T cell therapy patients, and it's cytokine release syndrome, or CRS. And basically what this is a couple days after the patients have had the therapy, they start to experience basically flu-like symptoms, real high fevers, they're fatigued, they usually have body aches, and this happens because these new T cells that have been introduced in the body are multiplying and they're attacking the cancer. And so the body's natural response is to treat it as if there is a disease in the body. However, there is a remedy for this, so it's not like you get this and then once you have the side effects you're going to die. They can reverse the side effects really quickly. They just give you a drug. You take the drug, tocilizumab, and you get rid of the side effects fairly quickly. and then you're good to go. The other big side effect in patients is CAR T cell related encephalopathy syndrome, or CRES. This starts further after the initial therapy, and the symptoms are basically, it's like you have a concussion because you become disoriented, you're confused, sometimes you can't speak for, during, when you're having this reaction. However, it is completely reversible. There's no evidence that there's that there's neurological damage past the reaction itself. Once it's gone for a couple days, a few days, usually patients are right back to normal, and they're like nothing had ever happened. Right now, there are just a few types of cancer cells that are being treated for with the CAR T cell. Usually, it's in patients with non-Hodgkin's lymphoma or childhood acute leukemia. Usually with these patients, you have to have been through 2 unsuccessful treatments already, and then you can have, have the CAR T cell. But right now, it's mostly those 2 types of cancerous cells that are being looked at, and the CAR T cell therapy is being used for. Right now, they're looking into expanding, hopefully what the CAR T cell will be able to attack, such as just B-cell lymphoma, mantle cell lymphoma, and then acute myeloid leukemia. So, as they keep advancing, hopefully more cancers will be able to be combated using this kind of therapy. So with that being said, scientists hope that one day this could replace chemotherapy, stem cell transplants. So right now they're looking, they're really studying hard, how can we make this combat multiple types of cancer so we don't have to have these other 2 options where we can just do this and things end up good and we can really combat cancers, different types of cancers. Like I touched on earlier, just really to go back over it, the advantages of this are obviously that it's at one infusion. You're infused one time, and then these cells are continually grow inside the body. Once the cells have been injected back inside of the person, then they're there. They will continue to grow, and hopefully, through this, it allows for better combating against a relapse of cancer, because they already are in the body and they recognize different, the cancer cells that are, if they come back. Right now, about 40% of patients who have received the CAR T cell therapy are still in remission, which is a good thing. However, patients whose cancers were very aggressive, those patients were also doing well. And then lastly, I want to touch on just, what kind of person, what kind of patient is a good for the cell therapy. And usually it's, children or adults, either with the pediatric acute leukemia or lymphoma. And those are the types of patients right now that they're really using this on. And so that is a little in-depth look at the CAR T cell therapy